Every joint can cause a little pain once in a while, but with rheumatoid arthritis, several joints hurt permanently. Are there any effective vital substances for this? Rheumatoid arthritis, also called polyarthritis, is a common but very difficult disease because it is really painful and invalidating. In Switzerland there are about 50,000 people affected, and in Germany more than 500,000 people. It all starts somewhere in a joint that gets inflamed. It can be a knee, an elbow, or a finger joint that suddenly starts hurting. It swells, it is warmer than usual, and sometimes a bit red. These are typical signs of inflammation. You can test this in the lab. There are several rheumatoid factors in the blood that can be tested. These rheumatoid factors are usually on higher levels, and you can diagnose the issue like that. What happens when you have rheumatoid arthritis? Let me draw a schematic joint here. Here are two bones. This is the case with practically every joint. Two bones come together. Here we have the joint capsule around the outside. And here inside the capsule, the synovial fluid is produced. Right here in the middle, the fluid is called synovium. It's wonderful. It's like an oil. It has lubricating features unlike any oil in the world. It is an ingenious system that works wonderfully without pain. With arthritis, this mucous membrane becomes inflamed. Of course, this jelly capsule goes around the two bones. When this synovial mucosa is inflamed, inflammatory factors, white blood cells, and other inflammatory substances get into this joint fluid. This means that the bones and a piece of the cartilage on the bone get attacked by the inflammation. The joint as a whole, the cartilage, mucous membrane, the bone is all eaten away with time. And it's self-explanatory that this is very painful. Now how can we now alleviate this inflammation? In conventional medicine we use cortisone. This has a good effect, but unfortunately, for not very long. Then there are these rheumatic medications, ibuprofen, Voltaren, and so on. They work great against the pain. They are also called anti-inflammatories, but the inflammation actually does not really decrease. And if that's not enough, then you need to get methotrexate. But methotrexate is a chitosat. This is a drug that interferes with the propagation of cells. And if all these drugs show little effect, immunosuppressants are used, also called biologicals. They are effective, but they come at a high price, namely that the body's own immune system gets suppressed. What can we do with vital substances? Basically, a healthy immune system is important in all autoimmune diseases. Conventional medicine assumes that the immune system has become ill and is fighting against itself, its own tissue, and destroys it. In my experience, this is simply not true. I always strengthen the immune system without it getting worse. When I support the immune system, I experience an improvement. And that's done with vitamin D. You have to dose it high, a few thousand units per day. Always under control so that the level does not go above certain levels, but we must bring the vitamin D level to the highest level possible. Omega-3 always plays a major role in all autoimmune diseases. Omega-3 fatty acids from fish, algae, are very important. Omega-3 levels are low in all autoimmune diseases, and we need to increase those. So vitamin D and omega-3, the basic therapy for rheumatoid arthritis. Now in nature, there are also anti-inflammatory substances and they can be used here as well. OPC, for example, which stands for oligometric proanthocyanidins, found in many berries, fruits and grape seeds. There are also products on the market that contain high doses of OPC, a very good anti-inflammatory agent from nature. Then you can use frankincense or the Reishi mushroom, a Chinese medicinal mushroom with fantastic anti-inflammatory features. In nature, we have several really good anti-inflammatories. Aronia berries or chokeberry extract. These products have a high dose of OPC and other polyphenols which have anti-inflammatory effects. Then, of course, the gut treatment is always a part of the therapy, because all autoimmune diseases begin in the gut. That's why I recommend you take a closer look at your intestinal function. You will find a link below with information on how to treat and heal your gut. So these two things belong together, anti-inflammatory and gut treatment. And this is how you can relieve the situation in a natural way.
Diese Schmerzen lindern auf natürliche Weise.